national launch and training of key stakeholders on the use of the National Guideline for Integration of Adolescent and Youth-Friendly Services into primary healthcare facilities in Nigeria, and is holding here today. So having observed all the protocols, I will read the speech of His Excellency. I hope one day I will also be an Excellency. It is my great pleasure to welcome you to this epoch-making event of the national launch and public presentation of the National Guidelines for Integration of Adolescent and Youth-Friendly Services into primary health care facilities in Nigeria. Today marks the achievement of another major landmark event in advancing the issue of young people in Nigeria. The need to set minimum standards for the of adolescent and youth-friendly services into primary health facilities has necessitated the development and production of the guideline we are gathered to launch today. Crucial in the light of the necessity to provide adolescent youth-friendly services at the grassroots levels where a significant percentage of adolescents and other young people live. The document was developed in collaboration with the Planned Parenthood Federation of America, National Primary Healthcare Development Agency, with the funding support from Ford Foundation. And I'm sorry, I did not personally recognize our Professor Konofua, maybe because he came in, well, we have already said, but he has been our teacher both at the postgraduate level and even still very strong enough to run other NGOs who are really big support to the Federal Ministry of Health. And we want to rely for your continued support. Some other major milestones has occurred in the implementation of Action Plan for Advancing Young People's Health and Development in 2014. The Federal Ministry of Health, in collaboration with partners as UNFPA, T-SHIP, FHI 360, and AHIP, among others, conducted training about Kano to build capacity of healthcare providers in the provision of adult and youth-friendly health services to improve health of our young people. Furthermore, the Federal Ministry of Health, in collaboration with Action Health Incorporated, is providing support for the Nursing and Midwifery Council of Nigeria to integrate the principles and concept of young-friendly health services into training curriculum of nurses and midwives in this country. This process has reached advanced stage and will culminate in training of students in School of Nursing City as a result. This will start up
this. Adolescents' health are not being provided in primary care level. Because if you look at the architecture in terms of healthcare provision in this country, the primary care remains the platform in which about 70% of Nigerians can easily get access to service provision. Unfortunately, a large component of the population of this country, the youths and adolescents, services that are friendly are not being provided at this level. So we felt that it's important that primary care provide integrated and comprehensive services. We've in the last 1 to 2 years demonstrated that first we've decentralized HIV services to primary care centers. We've also been able to decentralize quite a lot of other programs to primary care level. The essence of this is to ensure that any time any Nigerian could just walk into a primary care center and get complete service. Because this is a level of care that within 5 kilometer radius of where every Nigerian lives is available in most locations. Unfortunately, services are not complete in terms of integration and then comprehensiveness of service provision. So today's event, which is integration of adolescent and youth-friendly services into primary care is very historical, is very strategic. We believe that our youths should have access to preventive services, should have access to curative services, should have access to referral services, and should also have access to community-based services. Because this document is speaking to these 4 components. I'm happy that we have a lot of representation from states. Ultimately, these documents will be on and run by the states. We at the federal level will provide leadership, coordination, and the monitoring in terms of ensuring that this happens. I want to assure the Home Minister, key stakeholders, that at the primary care level, from the agency, we will continue to partner with all states and local government to ensure that this document becomes a working document. Because ultimately, what we intend to achieve is not just to launch the document and then it becomes another launching, No. We're not just doing it for the sake of doing it. We're doing it to, at the end of the day, ensure that policymakers, program managers, implementers, and other key stakeholders in the health sector will cascade this document and use it to train health workers all over the country with the essence of integrating adolescent, youth-friendly services into primary care. So we'll continue to partner with states and local governments. We'll continue to partner with other stakeholders to ensure that this happens. On this note, and on behalf of the National Primary Care Development Agency, I want to assure each and every key stakeholder in the health sector that we'll continue to push the drive towards integration of services at PNC level. And I also want to challenge Nigerian youths, challenge adolescents, that they should take up these services at the various primary care level. We also want you to monitor to ensure that what will be launched this afternoon, this morning, will actually be implemented in your various states. I'm happy that program managers from state primary care development agencies are here. This is also a challenge to you. We'll be tracking this. We'll be developing scorecards to assess implementation of this document. On this note, I once again welcome you and commend all stakeholders that have contributed to making this document a reality.